Working from home has become a big part of a lot of people's lives these days, and with that, a bigger conversation around employees' mental health is happening as well. To talk a little bit more about that topic, we're speaking to Dave Angus. He's the president of Johnston Group, which has consistently been on Canada's top managed company list since 2001. And most recently, Globe and Mail has named it a top employer among SMEs in Canada. So congratulations on that.
Well, thank you, Eleanor. Great to see you.
Yes, it's great
to see anybody nowadays,
yes,
actually.
It's true. Well, let's talk about that. A lot of people are working from home.
Yes.
Is that still continuing at Johnston Group?
Yeah, we have over 90% of our staff still working from home, and that's been that situation since last April, actually. So it's been a long time in this effort to continue to run the business, but also look after people and make sure that they're safe. So we're not sure exactly when people are going to start coming back. I'm not sure anybody really knows right now, but we're already starting to look at the kinds of things we're going to have to do in order to safely bring people back to work and what kind of policies we're going to have in place for employees going forward.
Do you think there are certain things that employers need to keep in mind as they start to adjust to perhaps bringing more staff back into the office?
Yeah, as much as we're not certain in terms of when we're bringing staff back, we're trying to create as much certainty about what it's going to look like when we do. And so I think all employers are now looking at what is their work from home policy going to be. We know that the majority of employees, and we're no different than any other, actually appreciate some of the benefits to working from home. And so, what is that balance between kind of work and life? What technologies are we going to have to put into play in order for them to be productive? What kind of impact does it have on culture to have such a remote workforce? So all of these things need to be considered. But there's other aspects of what are the health protocols going to be and what should they be in a workplace like this? Do we need to set up our workplace differently to make people safe and keep people safe here? What's our vaccine policy going to be? And that's a big discussion right now in terms of respecting the right for people not to have a vaccine, but also doing what we need to do in order to keep people safe. So what does that look like? So all of these discussions are so critically important, and they're happening now. And so a lot of work is focused on what it's going to look like in the new normal.
So your business provides employee benefit solutions to companies right across the country.
Yep.
What kind of trends are you seeing when it comes to employers that you're dealing with, when it comes to dealing with working from home and employees' mental health?
Well, I think one of the big trends right now in our space, but I think it's a national trend around mental health. As much as we're focused on the virus right now, once we get our hands around the virus, I think the big health issue is going to be mental health related. And I think a lot of it has to do with the isolation that people are feeling through COVID. Isolation has a big impact on mental wellness. And so what we're seeing in our space right now is a lot of innovation, a lot of new tools, where it's not just about counseling, it's also about some of the preventative things people need to have. And I see a big pressure on employers to be providing those to their employees. We just launched a new product called Hugger, actually, which was actually developed by a couple of entrepreneurs out of Saskatchewan. And one of them had lived experience who went through mental health issues because of isolation. And so he developed a product that focused on monitoring how well they're doing, provided a platform where family and friends can interact with them, which is such an issue with people that are going through mental health issues because of isolation. So another new tool in the tool chest, but there's lots of innovation happening in this space, and I think that's going to be a big part of our focus going forward.
Right before the pandemic hit, you launched a telehealth platform, quite timely.
I know.
That you managed to do that.
So visionary.
Yeah, it was so visionary. So give us an update on that.
Yeah, we launched it in September 2019 because things were going that way anyway. There was a sense that there needed to be better digital tools for health. But I got to tell you, when COVID hit, it was a godsend for people. Just to talk to a doctor virtually, either by phone or virtually, and just assess symptoms for COVID. Do I need to go get tested? Are these symptoms that line up with COVID? Just that alone was a huge benefit to people and employees. But it goes beyond that now. There's so much focus and effort in healthcare around COVID. There's so many other ailments that people have that they'd love to just kind of get an assessment from a doctor. So on average, we're getting access to doctors within an hour of the phone call, and over 91% of all afflictions that are being addressed through it are being solved with one call. And so it's been very successful part of our program. We also launched it to our Indigenous clients, so those in remote communities that have now quick access to doctors to help assess their symptoms and ailments. So it's been a great addition. I think people are really relying upon it now as part of their healthcare platform.
Thank you so much. Really insightful.
Great, thank you.
If you would like to learn more about Johnson Group and its services, you can go to our website at Economic Development Winnipeg.